Thank you, Dr. Dora, so much for that fantastic keynote, and to Dean Freed for leading the questions. So we're going to start the first panel, Understanding Cities, Understanding Health, State of and Challenges to Scholarship. I'm going to introduce all three speakers at once, and then each one will come up and make their presentation. I'd like to ask that all questions are held until the end, and we will have a similar format and conversation and open it up to the audience. So our first speaker today is Dr. Gina Lovasi. She's assistant professor, Department of Epidemiology at Columbia Mailman School of Public Health. Dr. Lovasi's research examines how local policies and initiatives influence cardiovascular and respiratory health, seeking to understand whether the anticipated health benefits have been realized and to explore any unanticipated health effects. Dr. Lovasi received her PhD and MPH in epidemiology from the University of Washington, where her research examined neighborhood walkability and neighborhood socioeconomic characteristics as determinants of physical activity and cardiovascular risk. She is an investigator with the Built Environment and Health Project, conducting research exploring how cities could be physically restructured to better support the health of children and adults. Key aspects of the local environment measured in her research have included walkable urban form, sources of healthy and unhealthy foods, tree canopy coverage, and other aesthetic amenities, and pedestrian safety hazards related to crime and traffic. Health outcomes recently studied include cognitive development, asthma, allergic sensitization, myocardial infarction, sorry if I messed that up, I am an architect, sudden cardiac arrest, physical activity, and obesity. She works with the Columbia Center for Children's Environmental Health and the Columbia Population Research to incorporate GIS into a range of health-related research projects in vulnerable populations. Dr. Lovasi also teaches a doctoral course on advanced techniques for epidemiological research and serves as co-director for the Epidemiology and Population Health Summer Institute at Columbia University. Gina also has participated in my studios and come to GSAPP on several occasions, and recently has traveled with us to Rio for our Rio dos Padres studio. Second speaker will be Giovanna Barassi, Chief Curator at the Canadian Centre for Architecture. Giovanna is an architect and an editor, and has curated since 2005 several major exhibitions at the Canadian Centre for Architecture, also known as the CCA, and edited the related books with a particular focus on how environmental and social issues are influencing today's urbanism and architecture, which includes environment approaches for tomorrow, some ideas on living in London and Tokyo, journeys, how traveling, fruits, ideas, and buildings rearrange our environment. With Mirko Zardini, she co-curated Sense of the City, Sorry Out of Gas, Actions, What You Can Do with the City, as well as the 2011 exhibition and publication, Imperfect Health, The Medicalization of Architecture. Before joining the CCA, Ms. Barassi was editor for Lotus International and Lotus Navigator, and deputy editor-in-chief for Abitare. Our last speaker in this session and for the morning will be Dr. Andrew Rundle, who is an associate professor at the Department of Epidemiology and co-director of Obesity Prevention Initiative, Columbia University Mailman School of Public Health. Dr. Rundle's research focuses on the determinants of sedentary lifestyles and obesity and the health-related consequences of these conditions, particularly the role of sedentary behavior and obesity in cancer development. He directs the Built Environment and Health Research Group, a transdisciplinary team of researchers studying how neighborhood, built, and social environments influence diet, physical activity, and in turn, obesity risk. His work on neighborhood-level effects has been used as part of the scientific rationale for the New York City Active Design Guidelines, jointly published by the Departments of Design and Construction, Health and Mental Hygiene, Transportation and City Planning, and for the Mayor's Food Policy Task Force, Food Retail Expansion to Support Health, also known as FRESH initiative. He and his collaborators have also been studying how neighborhood characteristics influence childhood neurodevelopment, childhood asthma risk, and depression and disability among the elderly. He is currently developing projects to study biotic resistance genes in bacteria. So with that, I'd like to welcome Gina to this podium.
Thanks so much, Hillary, and thanks to everyone for the opportunity to be here, and to our keynote speaker. I really enjoyed your comments. And what I want to do is just first acknowledge some of the projects and collaborators that were just mentioned as part of my bio, and then move forward from there to think about what we need to know in order to make cities healthier and the progress that we're making in doing so. And so what I want to do is actually to be somewhat forward-looking and to think about really what is it that we need to know, what do we need to do to move the research in the right direction to help us either to come up with new approaches or to refine the interventions that we're currently investing in. And I think in the neighborhood research that's relevant to health, there's been some approaches that try to draw a very close analogy to randomized trials and to look at what happens if we move individuals into a new kind of setting. A lot of these have been in the setting of public housing, trying to understand what happens if we pick up an individual or a household and move them somewhere else. And in my work, I'm really interested, and I think what we really need to know is what happens if we invest in the communities around people, if we invest in cities broadly or in particular areas within cities, and how can we get the evidence base that will help us understand the right approach to change cities. One of the things that I think we can do is try to track the ways that cities have been changing over time to understand how health-related or other resources in the community have been distributed, how increasing access has been realized, so that we can better understand the status quo and potential sources of resistance to changing the current health disparities in access to health-relevant resources. So I put up some healthcare-related resources, but you could likewise think about aspects of the food environment, physical activity venues, public transit opportunities. In moving forward, I think it's crucial to think about how we can really evaluate one area compared to another. And so one approach that I think is promising is to think about taking different areas, and so this is an example looking at counties in the New York area where each line represents the increasing access to a health facility. We can then find pairs of areas that started out at a similar point and then diverged, and try to use that kind of neighborhood change to understand better what we can do and what effects we should expect from an intervention at a neighborhood or at a county or city or larger level. I think in evaluating the health impact of policies, it's both very important to be thinking about how to generate new ideas for interventions that we haven't considered previously, and to look at the interventions that are continuously being tried around us so that we can have a better understanding of whether we're getting the benefit we hoped for, and whether also we're having any unintended either co-benefits or unintended negative consequences that could play into helping us to refine the approaches that we're taking. So what are we doing to make cities healthier? I think there are a couple of different areas. One is to really support some of the transportation initiatives that we just heard about, thinking about ways to make active transportation more part of people's lives. In New York City, we've seen zoning changes, and I think one interesting aspect of this is that zoning that's been put into place to protect health at one point may not be protecting health in the current environment, where we might have wanted to segregate land uses to protect people from industrial pollutants. It might now make more sense to mix land uses, or to at least remove some of the restrictions that could keep people from using active modes of transportation. So I think it's really important to look at the things that are in place to protect health and to reevaluate whether they're meeting the health needs in the current environment. Some other changes are really to invest in access to bicycling, to design guidelines that can help inform how we build cities and streets. And so I think that there's been good progress along these lines. What I also think we need to continue to look at and to understand is whether the approaches that are currently being undertaken for promoting active transportation are having benefits across all groups. And so I think the points about looking at health inequality effects are really crucial, and it may depend on how these interventions are done. Things like the bike share, what areas do they really cover? Right now, they don't necessarily reach to the areas of the city where obesity is higher. And so I think trying to bring that lens of inequality into our strategies is really important going forward. A second area where I do think we're making progress in making cities healthier and in thinking about new strategies is in air pollution. So I think as more people become car owners and are part of cities, it's really important to continue to think about this. Some of the approaches that have been proposed may work well, while others may not. And so I think looking at particular approaches and how they play out is going to be really important as we move forward. I was at an environmental pollution conference late last year where there was discussion about using license plate numbering to try to regulate who can drive into the city on different days. But one of the discussants brought up that in India that had led to people owning a second car that was in worse shape that had a different number. And so it actually didn't work. And so figuring out the ways that we can look at these approaches, understand what refinements we may need in order to really get the benefit that we had hoped for. One of the things that I've been interested in that's ongoing in New York City is tree planting as an approach to addressing air quality and to greening the city. And I think it's really important to take something like this, which has been built in part on an idea of respiratory health benefits, and to think about whether we get those benefits. And so I've been doing work to understand the physical activity and respiratory health consequences of having trees in urban environments. And I think my work has pointed to some ways that the current tree planting goals are somewhat oversimplified. If we really want to affect human level exposure to traffic-related pollution sources, we need to think about not just the number of trees that are being planted, and that's a lot of the ways the goals have been framed, but to think about the placement of those trees, to think about the traffic patterns themselves, which are more dominant in driving personal exposures, and to think about whether strategies such as optimizing species selection can help to reduce any unanticipated consequences, like consequences for allergic sensitization. We've seen some indications that tree canopy is related to having more allergy in the city. And so trying to look at that, also trying to look at the process itself. And I think there's been some interesting work around sort of what's the source of resistance to trees. The city collects information that if people call to complain about this tree planting process. And there was an interesting paper kind of looking at what does that dialogue look like. And so thinking about those voices, there were issues of provenance and of maintenance, and so thinking about how the process might actually be relevant for health, given that we know health is very much shaped by having control over your environment. Finally, I wanted to point to a couple things in the food environment. I think the research on how food environments shape our health splits into looking at the sources of unhealthy foods and healthy foods. And I think that there have been successes in each. In looking at unhealthy foods, I think a lot of attention has been around sugar-sweetened beverages and around fast food. And while we see that those are both related at an individual level, consumption is related to obesity, we haven't really got a great set of approaches to shape those personal exposures. I think some of the interventions around fast food and sugar-sweetened beverages haven't worked as well as we had hoped. But one of the things I think has worked well is relatively invisible to the consumer, and that's been a trans fat set of regulations. In New York City, it's been a ban of using trans fats in restaurants. And I think that this has been a really interesting type of approach. It's almost like fluoridating the water. It's kind of invisible in the background, and it seems like New York City has perhaps been able to nudge some national chains towards developing and testing and finding that consumers don't notice changes in the food. Dunkin' Donuts, for example, they released 50,000 stealth trans fat-free donuts. They didn't tell the customers. I think they wanted to see if people would object, and nobody noticed. And so I think that's a real success. If we can shift things in the background that make people healthier without depending on their own efforts. In addition, however, I think people who are determined to eat healthier need to have local sources to do so. And so I think looking at initiatives like the Fresh Initiative, which has been a set of zoning and subsidy approaches to incentivize new supermarkets, is going to be really important. And I think it's crucial that we look at both the health effects of this, also the survival of those supermarkets in these environments, so that we can understand whether there are other supports needed to invest in this way in healthy food access. I'm ultimately interested in whether these different changes to the environment can add up to health. And I'm particularly interested in cardiovascular and respiratory health. And it's a very challenging set of problems to look at this. And so I just want to point to a couple of those as I'm in the process of trying to evaluate some of the Bloomberg-era approaches to cardiovascular disease prevention. So if we look at the time when a lot of different interventions were underway to reduce tobacco use in New York City, to look at changing the air quality by investing in a number of different approaches, to look at changing the food environment and providing opportunities for physical activity, we can see that during that time, cardiovascular disease was decreasing, and it was decreasing faster than other conditions like cancer and respiratory disease. However, if we try to evaluate any one policy by looking at a time series like this that's just the deaths, we run into a challenge that we can't distinguish which of the many approaches that was done at the same time was really the key one. So we can perhaps try to look at a package of interventions and see how much benefit we could get from that. I think there are other lenses that by looking at interventions that should have affected certain populations or areas of the city, as we work with more disaggregated data, I think we'll have a chance to identify effects for a few of the approaches. But another challenge is that if we go back further, you can see that what we're experiencing is a continuation of a decline that had been going before this package of interventions came into play. And so understanding what the trajectory would have looked like had we not intervened is really difficult. We had already been seeing some benefits, presumably from previous medical and multisectoral interventions. So how can we separate this out and try to understand better the role of any one intervention? I'm really excited to see where this will go, but I think it's going to be difficult. Likewise, if we go into other cities and try to identify the effects of a particular intervention, we'll once again encounter that other things are going on at the same time, and that there are trends that were already unfolding. So I think the more we can be global, the more we can have multiple instances of comparison, the better shape we're going to be in to understand which approaches are most effective. So in thinking about moving forward, I just wanted to point to a couple of trends. One that I've been intrigued by is that there are a number of new technologies that could shape our food access. So this is an example of a supermarket in a transit system so that you could scan food items and have them delivered. We know that there are new options for delivery of goods, so this could change access to healthy foods and the way that people invest in accessing healthy foods. Other trends, 3D printing, and self-driving cars. I mean, there are technological innovations that could reshape and disrupt the way we think of cities. However, those technological approaches don't necessarily give us the answers for the slums and favelas and areas of informal development around the world where increasing numbers of families are living and where we have serious health challenges that can be met with low-tech solutions. And so I think finding a way to both anticipate the limits of our technology and where that's going and to leverage the approaches that we've already had experience with to make sure that we can achieve health for the broadest population possible is where I hope we can go. In thinking about health, the cities that support health are going to be supporting our other social and economic goals and the goals of having the kinds of lives that we want. So I really look forward to the conversation and to thinking about how we can get closer to an optimal set of city environments for health. Thank you.
Hi, thanks for having me here, and I really look forward to participate to this conversation. So, as Hilary has mentioned, at the Canadian Centre for Architecture, we initiated some years ago research entitled Imperfect Health, and so today I will show some of the results of this research that became also an exhibition and a publication. And so also some of our concerns as architects. Every day we are confronted with the problems stemming from energy crisis, consumption of natural resources, pollution, decreasing biodiversity, new epidemics. So we could say we are living in a sort of health-obsessed society. The perception that everything around us could be understood as a possible source of disease is bringing us to an obsessive pursuit of defense and fortification of our body. How we do this? Oh no, sorry. To overcome all the new illnesses, we have to voluntarily stay in shape or continuously fine-tune our body with individual efforts, or with the help of new technology and extensive and preventive use of medicine, only partially supported by new environmental and urban planning policies. So how, in fact, architecture and urban planning are responding or participating to these impelling issues? What arises by our research is that certainly this discipline could actively contribute to the construction of a healthier body, while designing a healthier architecture and a healthier city. However, a certain caution should be exercising in not considering architecture or urban planning as operational therapeutic tools. While perhaps partly responsible, architecture is not always capable of providing positive solution for the environmental or the sick body. For example, conflicting agenda and opposite of priorities might arise in designing a public space. The need to augment the body movement for user to fight sedentary effect might clash with opposite requirements of the increasing age society. Or the desire of more biodiversity in urban agriculture might challenge asthma and allergy priorities. All these considerations might suggest we will only be able to obtain imperfect solutions, or using a medical similitude, we will certainly incur in side effects. Today we live in a new historical environment context in which the clear antagonism between the purity of nature and the contamination of the city has been brought to a crisis. According to anthropologist David Harvey, we now inhabit a second nature, an environment profoundly marked by human presence and the result, a creative destruction. We can no longer immerse ourselves in nature as if it was itself a cure. If nature could be defined also as sick. There is potential risk in every natural element. A tree, its pollen, can trigger allergies. As Gina was explaining before, also Thomas de Ogren, especially in non-allergenic green spaces, argue, for example, that the selection of species for planting in the city is crucial toward reducing asthma and allergies cases, and in the future should be done in line with health priorities more than following aesthetical reasons. The origin and rapid propagation of the latest epidemics are tied by way of dietary needs to domestic and farm animals that have become incubators and vehicles for a deadly exchange of pathogens to our bodies. As a consequence, our judgments of nature variously continuously. Nature can be redemptive. So here, for example, is a treatment for asthma in an old mine in Ukraine, but could also bear the threat of new illnesses. Subsequently, the post-industrial city may today surprisingly be considered an agent capable of delivering treatment and perhaps producing a new urban age through myriad potential opportunities. The contemporary city seeks to be healthy in all its parts and consequently undergoing change, it changes inhabitants in turn. The majority of projects aimed at transforming the relationship between environment and a healthy body take place in the city, and they are achieved by means of the city structure. Its density and critical mass foster many initiatives. As we already heard many times, walking rather than driving, using public transportation, riding a bicycle, growing food through technique of urban agriculture and vertical farming, and aging in place are few of the plans that we could put in action. Under current conditions, the city is the optimal environment for settling. These strategies also acknowledge the city as an appropriate instrument of well-being. New tools and approaches to urbanism demonstrate how the city is not only a place of concentrated population, as well as social and environmental health problems, but can also be productive agent of delivering solutions. The architecture of the first half of the 20th century produced a new set of typology of reformed existing ones in the name of sunlight, air, water, and nature, elements that embody modern ideals of health and hygiene. Thus, the new building and their open space represented modern architecture, strength in configuring a symbolic space, if not actually curative, for the new man of the 20th century. At present, many designers and architects work with second nature materials, which usually include degraded or altered natural elements that can no longer produce the pristine architecture imagined by the moderns. But instead, all this dust, refuse, and contaminated soil provide new materials for conceptualization, elaboration, and use. Today's strategies offer architecture and urban planning and landscape a different role in the form of a double reclamation that on one hand repairs the environment and contributes to responsible use of a regional resource, and on the other gives the architect or the designer the chance to fulfill a new therapeutic function by widening this approach to include variables typically under responsibility of public health. This therapeutic function is limited to the most obvious features of a region pollution and can be achieved by means of sophisticated architectural solutions, such as facade that absorb dust or building with forms that evolve along with populated urban landscape, as François Roche project in Bangkok. So this is a building who is a model of a building who attract dust, and the form of the building will change as much as the building suck the dust in the air. Connecting structural elements with simple technical spaces create new set of responsibility of for New York Manifesto-like active design guideline. Specifically cited stairs and corridors simulate the everyday physical movement sedentary bodies need, so to combat mounting global condition of obesity and to prevent the loss of muscle mass due to aging. In operating in this way, the risk for our society that we would assume for architecture and urbanism the role of preventive and ongoing medicines or effective therapeutic tools. In this sense, we will need to accept that for all this discipline, a radical shift towards a kind of new functionalism related to the current moralistic philosophy, a sort of healthism. In deciding, for example, that architecture will be addressing or targeting specific user, considering this new therapeutic functionalism as patients, architecture will fail in its premises as over time will become obsolete, therefore ineffective as certainly unable to keep up with new health issues and evolving priorities. Certainly there are potential positive health effects from an ambitious, widely scoped design approach. Yet by accepting a potential therapeutic role, architecture and urban design become an integral part of a process instituted by public health, which requires that individuals take responsibility for themselves. With the issue of obesity, in particular, architecture is an active participant in new training regime that locates the body at the center of a series of processes of control and transformation in the name of a new culture of risk reduction and management. In other words, architecture function in various therapeutic programs is itself strictly prescribed. At the same time, therapeutic architecture as a possible form of treatment requires the direct active participation of the ill. A bill that encourages or forces you to take stairs to burn calories, or an engaging city that coerces its inhabitants to walk instead of taking a car or the bus, contribute to a healthier city and counter the problem of obesity at the same time. But this treatment is affecting only if the patient consents to participate, both physically and on a decision-making level. Failed experience of the 20th century provide enough evidence to suggest that architecture, urban planning, and landscape architecture should exercise caution, giving more attentive consideration to possible effects and outcomes. The unexpected, often unhealthy consequences of what has been celebrated as project are increasingly evident. We could consider the case of asbestos, for example. These are mines near Montreal in Canada. Once was regarded as an ideal material for every imaginable application, is today pronounced highly carcinogenic. Paradoxically, many architectural projects and buildings together tell an unavoidable process of defeat, the inability of architecture to offer an optimal or permanent fix on its promise of irrational parameters. As you very well know, the process of medicalization that is described by medical sociologists of our society has initiated a process in which non-medical problems of daily life, from anxiety to infertility, from aging to death, are more and more treated as medical. Architecture and urban planning rely increasingly on medical rhetoric to describe problems and arrive at solutions defined in the medical milieu. The architecture and urban planning have adopted the bellicose stand of Western medical rhetoric, aiming to combat illnesses, viruses, stress, in order to, instead of other attitudes such as simple activity of listening, or the idea of a process of improvement based on potential rather than the notion of treatment. So an ever-increasing number of human, environmental, and architectural problems are treated as medical, and remedies are sought in increasingly specific solutions. Tailoring requirements to a particular group of ill individuals leads to contradictory solutions, and finally to even greater segregation of various demographic groups. In this sense, architecture, subject to medicalization, should itself be considered a sick body. I will argue that the most significant shift for architecture today and urbanism will be from the idea of cure to the idea of care, in the process of taking care of our bodies and our environments. Thanks.
I'd just like to say thank you all for having me and thank you all for coming out. I'm going to spend some time, or my time, walking you through some of our research and results on neighborhood effects on physical activity and this idea of neighborhood walkability. So there will be graphs. I will show you some graphs and I'll walk you through them. I'd just like also to say that several of the people who have been integral to this work are actually here in the room. So Gina has worked with me on this project for a long time. Karen Lee from the Department of Health is here, who is part of helping us think through this. And Steve Mooney, a graduate student, is in the back of the room. So I want to think about how do we understand how people use space in a city. So how does the characteristics of that space affect how they use that space and how they get physical activity? As mentioned several times, physical activity is really important for health. And I will just say one thing, which is physical activity prevents cancer. We've also listed the other things that physical activity prevents. And so I just want to reiterate again that people are talking about physical activity as prevention and also as medicine. And the built environment in a city or actually anywhere provides a context in which physical activity occurs. And built environments can be supportive, inhibitive, or neutral towards our ability to engage in physical activity. And we have this hypothesis that variation in neighborhood built environments will influence physical activity and in turn influence obesity and other health outcomes. And one of the concepts that we've been working with is this concept of neighborhood walkability, which comes out of urban planning's literature and thought. And I show you two photos here. They're a little dark. These are from the websites of the community boards in New York City. And the top photo is from Queens, and the bottom photo is from the Upper West Side. And neighborhood walkability really talks about a set of urban design characteristics that support active transport. And active transport is walking and cycling. So providing freedom from private automobiles is how we think about walkability. And the top photo actually shows tree-lined streets, a sidewalk, individual family homes, driveways with cars, and absolutely nobody walking on the sidewalk at all. It's a very nice picture, but it represents what we think of as low walkability. The bottom picture shows high-density living apartment buildings. There's commerce on the streets. There's mixed land use. And there's a lot of people walking on the streets. And so the Upper West Side really is indicative of a highly walkable neighborhood. And we've been trying to develop ways to measure walkability in New York City. And we've developed the New York City Walkability Index, which combines 5 measures: residential density, intersection density, land use mix, subway stop density, and the retail building floor area to retail land use measure, which is a mouthful and comes out of urban planning, but it really talks about whether the retail space is retail space that you drive up to or retail space that you walk up to. So is it a strip mall or is it retail space at the bottom of a building that you can just walk in the door to? And we have been measuring this for all of New York City. So this is a map of walkability in New York City for every single block in New York City, color-coded, and our index has got arbitrary units. So the index goes from a low of -14 to a high of +13. And one of the things our group does is to try and think about how we can measure neighborhoods and then map those neighborhoods and then use this map data to understand health. And so this is our map of neighborhood walkability in New York City based on our metrics. Oh, whoops. One of our recent publications, we partnered with the Department of Health to try and understand if neighborhood walkability predicts actually engaging in active transport, so the number of bouts of active transport. And we used the community health survey data that's created by this Department of Health. And we looked at how the walkability of a neighborhood predicted the number of trips committed through active transport. And so this is my first graph. And the thing to know from all of my graphs is the red line basically represents no effect. And if this red dot is to the right, this means it's a positive effect. And if these little whiskers do not include the red line, then it's a statistically significant effect. And so what we were able to show through our statistical analysis and our mapping is that for every unit increase in neighborhood walkability, the number of trips committed through active transport increased by about 4%. And so our scale goes from -14 to +14, and there's basically a linear effect. So you see that neighborhood walkability at 4% per unit has quite a strong association with engagement in active transport. When we segregated the data to look at white, African American, Hispanic, racial ethnic groups, we see associations amongst whites and African Americans that are significant, but we don't see it among Hispanics in a way that is significant. And then when we look at low income and high income zip codes, we see similar effects in both high and low income zip codes. And so we I'm quite proud of this work. We've published this work. The city was very excited about this work. But one of the difficulties with this work is that how do we define neighborhood? Well, in this work, we use zip codes as a definition of neighborhood. So we don't really know how these people interact with the space in the city. We just know that they live in a zip code that's highly walkable or not walkable, and we know that the people who live in a highly walkable zip code engage in more active transportation. But I have no idea how these people actually interact with space in New York City. And so I think understanding how people use space is sort of where's the state of the academic literature and the research world is going, to understand how the way we've formed cities creates behaviors on sort of on a day-to-day micro scale. All right, my clicker is super insensitive. Help. So one way that a lot of people talk about neighborhoods is they just use census tracts. So this is a map of northern Manhattan, and this might be one of my study subjects, and this might be another study subject. And we might say, we'll describe their neighborhood in census tract terms. We might use zip codes. So now I've got the 2 zip codes blacked out that these study subjects live in, and they have these like weird shapes with these little weird hooks here. Another way we might do it is we might draw a circle around their home and say, the neighborhood that these people inhabit is the circle that as the bird flies, they can reach within 1 kilometer. And so we might draw a circle around each person's neighborhood and say, this is what their neighborhood looks like. Another approach might be to say, well, let's think about the street grid. And now these weird polygons are all the space that a person could reach just by walking along the street network. And we'd say, we'll call their neighborhood the space that you can reach by walking along a street network. But again, all of this is kind of fake. I don't actually know where my study subjects actually walk, where they actually hang out. And so this is a barrier to really understanding how neighborhood form predicts health and health behavior, because we need to understand how people use space. So we've partnered again with the Department of Health to take advantage of the study that they did called the Physical Activity and Transit Survey. And this is a survey of how people get around the city, but they asked people to wear GPS loggers. And they asked them to wear devices that also measured their physical activity. And so they were able to get 803 New Yorkers to wear GPS trackers for a week and also physical activity measuring devices for a week. And now we can actually start to think about how people use space. So this is the GPS data. All of those red dots actually represent GPS data that were captured from these volunteers. There's over 2 million, almost 3 million dots. So you can see here the Staten Island ferry. There's people using the ferry back and forth. You can see the bridges. Down here you can see people using the parks. And you can basically see that the data is so dense that it almost maps out just the street network of New York City just by tracking through these GPS devices. So now we have super high resolution data on how people are physically using the city. So we wanted to try and understand how people use their neighborhoods. And so this is actual data from one study subject, and the gray circle is all of the neighborhood space that's within 1 kilometer of their home, and the dots represent the GPS tracks. And the white area is the minimal polygon that encloses all of those GPS tracks. So this is basically when you see those National Geographic specials and they've been tracking some timber wolf with a GPS logger. This is the exact same technique that they use for the timber wolves, but now we're using it for the residents of New York City to try and understand how they use New York City. So if you're in one of my studies, I'm just going to treat you like a timber wolf. So we have these interesting now measures of a week's worth of moving around somebody's residential neighborhood, and we have these strange polygons that sort of track the space that they use. So what we did is for every single person, we created one of these polygons to track where they had been, and we call this a hull. We also created just a circle around their home and said, what does it look like around their home in this circle? We also then said, what is the area they could use in this circle but didn't use? We also said, all right, the circle's not realistic. Nobody can fly through space. Let's just use the space that they can reach on their street network. So we said, let's describe the neighborhood based on their street network. And then let's describe the space in their street network that they actually never used. So we have these 5 measures of neighborhood. And the most commonly used measure in the literature is just this circle. Most people just define a neighborhood using this circle. So the first thing is, all right, how much space does somebody in New York City on average use? So if we pretended that somebody's neighborhood was a circle and we subtracted out all the water, that's about 2.9 kilometers squared. So not exactly 3.14, which is the area of a circle, but 2.9. If we look at the area that they can reach on their street network walking 1 kilometer, it turns out that that's just a little bit larger than 1.5 kilometers squared. But the area that they actually use is actually slightly smaller than that. So the area on average that people use in their residential neighborhood is only 1.38 kilometers squared. So it's actually a lot smaller than what most people assume people actually use. When we look at the areas that they don't use, so in fact the area within a kilometer of their house that they don't use is actually larger than the area that they actually use. And this similarly for the leftover street network area. So New Yorkers inhabit a space that is a lot smaller in their residential neighborhood than we normally assume that they inhabit. Okay, so this area is smaller than we usually think. Now it turns out that urban form predicts the total neighborhood area used. So one of our first thoughts was that crime, so fear of crime, would influence how much space somebody used in their neighborhood. Well, it turns out that the homicide rate within 1 kilometer of somebody's home has actually got no association with how much space they use. So it turns out that homicides in a residential neighborhood have no impact on how much space somebody uses. So my red dot is only slightly to the right of the red line. So maybe how wealthy a neighborhood is. Well, it turns out that how wealthy a neighborhood is has absolutely no impact on how much space people use. But residential density, so the more residentially dense a neighborhood is, the smaller the space is that people actually use. So in dense neighborhoods, people use smaller amounts of space in their neighborhood. But as the number of intersections increase, the amount of space that people use actually increases. So that by having tightly dense street networks, it actually makes it easier to access space. And as a result, people actually use more space in their neighborhoods. It turns out that land use mix, which is a function of zoning, so the mix of commercial, retail, governmental land uses has no impact. So how much mixing of land is in a neighborhood has no impact on how much space people use. But how retail is set up. So if retail is set up so that you can walk up to it, so walk up retail, the more walk up retail as opposed to drive up retail you have in your neighborhood, actually people use much more space. And then subway stop density. So the more subway stops in your residential neighborhood, the less space you use, probably because you can just exit your neighborhood, and because I'm using GPS tracking, I can't track the study subjects through the subway system. So the more opportunities people have to use public transit, actually the less space they use in their neighborhood, but probably they use more space throughout the city because they can access more space. So what we see is that the urban form of a residential neighborhood has an impact on how people use space in a way that things like homicides and crimes do not seem to have an impact on how people use space. I just got the 5-minute warning signal. So one of the things we wanted to look at is the space that people use more or less walkable than the space that they don't use? And what we see is that the residents of New York City selectively use space that is more walkable than the space that they don't use. So my green icon here, this is the walkability score for the space that people did use. And then our two measures of the space that people could use but don't use, which is here and here, we see that the walkability is significantly lower in the spaces that they don't use. So people are selectively choosing to use neighborhood areas that are more walkable and meet these ideas from planning about what influences how people walk and how they take part in travel, either cycling or walking. So we see that people are selectively using more walkable areas in their neighborhoods. And then we were also measuring the physical activity of our participants. So one of our key questions was, now that we understand that urban form predicts how people use, does it also predict their total amount of physical activity? So what I've plotted here is sort of quartiles of neighborhood walkability. So this is the lowest walkable neighborhood, and this is the most walkable neighborhood, and these are in between neighborhoods. And this is the minutes of moderate and vigorous physical activity that each person got during a week. And what you can see is as neighborhood walkability goes up, there's a positive association with physical activity. And when we go through the modeling, what we see is it's about 100 minutes per week of increased physical activity that is associated with differences in neighborhood walkability. One of the other things that we see for New York City is the current national recommendations are that you get 150 minutes of moderate or vigorous physical activity. And most New Yorkers are actually beating the national recommendations. So this neighborhood, people living in this neighborhood are basically at the national recommendation. And it increases from there. So New Yorkers are actually meeting these recommendations to a large extent, but their total amount of activity is positively associated with urban form in the neighborhoods that they live in. And so what we see is when we use these really precise measures of how people use space, we can understand how urban form predicts how much space they inhabit within their lives. We can see how big that space is, and then we can see the effects of the characteristics of that space on their health behaviors, in this case, physical activity. And so in thinking about how to push forward this idea of how we understand urban form effects on health, I think we want to dive much more into how people understand neighborhoods and how people react to those neighborhoods and utilize those neighborhood spaces. So the conclusions is we're really at just the beginning of understanding how people use space. And if researchers are thinking that people define neighborhoods and use neighborhoods in a certain way that is completely different from how people actually think about neighborhoods and actually use neighborhoods, the results of our research are probably going to be wrong because we're not translating correctly into our research models what actually happens out on the street. Luckily for me and my focus on neighborhood walkability, what we see is that overall, neighborhood walkability and its effect on physical activity seems relatively robust to the different ways that we think about neighborhood space. And so the different types of work that we have done keeps coming up with basically the same answers, regardless of how we interrogate the data. And so this is a big project with many players, and the Department of Health and Mental Hygiene has been really at the fore of providing the kinds of data that go into understanding how neighborhoods affect health. The team includes epidemiologists, sociologists. Lance Freeman is from GSAP. He was the lead author on one of these papers. So it's a big, huge team for which I am just one member presenting the results. Thank you.
Invite the panelists to come back to the podium. I think we are running a little bit behind schedule, but we've caught up to the architecture pace. Okay, all right, this sounds good. Presentations, very extraordinary, and I mean I can begin to see some specific overlaps and questions, and it might be more interesting just for the sake of our conversation if you guys have reactions to each other's. I'm not sure if that's the best way necessarily, but I mean it seems to me that there are converging interests and then also modes of representation, and maybe even building a little bit on Dr. Dora's, or from Dr. Dora's presentation in terms of those actual representations and the idea of projecting something for the future. So I think in the way that, let's say, Gina, your studies and research, and particularly the issue around zoning and mixed land use and the representation from that, even the way you presented the kind of walking through the grocery store and scanning it, made me think a little bit of our time in Rio dos Padres. Not to go into this too much, but I can't help but think about that in the for sale signs within the favela of how you could buy a bedroom, or a bedroom and a bathroom, or a bedroom and a roof, and just this kind of strange mashup almost in a way makes me think of potential new models for zoning here in New York. And so I was really struck by the intent, but also the graphic and the representation of that. So I don't know if you want to start.
Well, thank you very much. I think one of the interesting things, of course I'm aware of Andrew's work because we work closely together, but is that going forward we can move some of the understanding about mobility towards understanding how not only New Yorkers move, how people in a favela of Rio move, and how interventions like bus rapid transit projects could affect mobility patterns. And in thinking about you asked specifically about the food environment, sort of novel ways to access the food environment, I think our work trying to understand how families get healthy foods has pointed out the fact that there's a lot of time used in accessing healthy foods if you're living in an area of the city that doesn't have that access right now. And so there may be ways that investments in access to healthy foods not only change the diet, but also free up time for other parts of people's lives, other goals that they want to pursue.
I was just going to add, so in one of our studies among children in New York City, who are all living in areas of the city that have been designated as food deserts and are available for the Fresh Initiative. In our surveys, 97% of the moms report that they either use a supermarket or a Price Club store to buy their groceries, but live in neighborhoods that have been designated as underserved. And so again, what we're seeing is this sort of burden of transportation to get groceries, whether that's by car or subway or bus, we don't really know at this point, but we know that there's a big time burden involved. And if it's private automobiles, there's probably an air pollution burden involved just through the amount of transportation that has to take occur for families to get to food.
Maybe one thing I wanted to ask is because, for example, your study on the neighborhood that I found fascinating somehow define how much people use the space and which are the trajectory they do for proximity in their neighbor and so on. I think the big challenge for architects or designers is like, at least the way I see it is like, to make people walking, we really have to have an interesting design, and you might do a small part of the neighborhood. You might do a small house, and so to pass from that vision that is like, okay, how we have a neighborhood that had this high walkability, then become an issue for one architect who might do a house and a piece of a sidewalk, and how even if he's willing to engage to this quality, is like how this could be taken as a when this the area of your influence might be the city, for sure could go further than this, but
I mean, the kinds of ideas about walkability that I've worked with are very much more related to planning and zoning and transportation infrastructure than they are to the construction of a specific building. But we have done work, and Gina can talk to this, about this notion of aesthetics within a neighborhood, and whether there are aesthetic qualities, design qualities that also influence physical activity because it just makes it pleasant. So the kinds of variables I'm working with in my talk say nothing about the experience. It's more about utility, but it's nothing about the aesthetic, the pleasure of being out and walking about. And so I haven't touched on that at all, but Gina has been thinking about this idea.
But you don't think that is part of that?
Like, I absolutely do, but within the time allocated, I didn't have time to dive into aesthetics. No, I absolutely think it is important. Like the experience of walking should be pleasant, not just like, oh, there's a lot of real estate with mixed land use near me, and that's going to make me walk. So I think it should also be pleasant, and I certainly enjoy it when it's pleasant. But Gina has been heading up the research on thinking about aesthetics.
Yeah, so some of the things that we've tried to do in thinking about aesthetics are either informed by urban design ideas like transparency and trying to understand specific sort of landscape or streetscape interventions that we can pick out from large data sets that cover the city, or that we can assess through tools like Google Street View that allow us to kind of virtually look at streets. Also, we've been trying to tap into the different elements of the environment that could relate to pedestrian sense of safety and also sense of interest. So trying to pick up aspects of the commercial and architectural and natural environments. So I've been looking at street trees, at clean streets and clean sidewalks, physical disorder, at access to sidewalk cafes or having street trees. And so I think trying to understand these different dimensions and maybe getting back to Dr. Dora's comments, trying to understand how different stakeholders would view these different dimensions. I think anytime we get into talking about the sort of attractiveness of an environment, we have to be guarded about sort of attractive to whom and what are we interested in. I think particularly addressing a sense of safety can be an important way forward. In thinking about a particular building, I think what our work points to is, being open about what kind of building that is and its relation to other buildings in the surrounding environment, so that movement from that building to the other places that somebody in that building is going to access can be smooth and preferably, include some active options.
I just want to make one more comment, and then we can open it up to questions. But what's interesting about this to me is, as an architect, I can't help but think a little bit about how our profession over the last few decades has changed in terms of our structure, and that we see architects shifting more and more to a kind of periphery, taking on more and more collaborators in doing projects. So even, let's say, in a small office such as mine, and I'm doing work around the world, I will call a structural engineer, I will call a code consultant, this kind of thing. And I feel like it's a ripe moment for, in fact, why are we not asking, you guys to become part of this bigger team? And I know, of course, this happens on certain projects, and there are many issues about funding and time and this kind of thing. But it seems to me that I know a little bit from talking with Dr. Karen Lee, who is going to present later. The active design guidelines comes out of the Department of Construction here in New York City, but that there's a kind of away from you guys, and then through the city that comes back to the architect. So we have this kind of cycle. But are there ways that we could begin working in a much tighter loop, and maybe pushing, not necessarily even pushing backwards in the cycle, but to try to bring it closer? I mean, I feel like this is a kind of exciting moment where this is really could become a possibility. So I don't know if you have any comments.
So, I can speak to some of the ways that I see us working together, and some of the things that make me really excited about potentially working across two collaborators at GSAP. And that's in finding the next set of questions, in finding how to reframe the kinds of changes in cities, how to highlight the effects of different types of changes on health in a way that is more inclusive of the different health outcomes. Whereas in public health, we tend to narrowly, focus on the particular outcomes that we can assess very concretely. Having an opportunity to think in a more forward-looking way about what could be possible to support health is really exciting to me. I think the challenge is in the slightly different goals and the different products of our work. So I think coming together much earlier in the process, rather than trying to send peer-reviewed publications to folks in architecture, or have us look at the studio books that are produced from some of your work, I think working together at the point of framing the questions, of coming up with what's the process to get the right questions on the table, to get the right information, the right voices as part of addressing how we can make cities healthier.
And I would add that we're in the midst of negotiating with a real estate development company to partner with them to do scientific reviews of how to bake health into their real estate development projects. And so we've been talking for several months with this company, and hopefully we will be working with them to help them think about how they do real estate development.
Maybe I just add, I think thinking about your last statement, Gina, I think the issue are really more about, I think the objective are very similar. I think maybe the things that we have to understand are the tools that let's say, I didn't show this example, but for example, there is this Dutch architect, Herman Etzberger, who did many buildings for all elderly people. And for example, he designed a door, and is I think you call it like a horse door, like a door that opens in the middle, like in two parts. No, it's like there is a part fix, and you open Dutch door. I don't know, Dutch door. Okay, so everyone was looking like, why this Dutch door? And in his idea, this house for elderly people was actually built as a city. So you have this corridor will be kind of streets, and so this door was a way for him to, you are in your room, but you want to look what is going on outside. You have a little bit of privacy. If you want, you could stay on the door open and maybe speak with other people passing by and so on. So what I think, I just giving this example, what I think the challenge will be that somehow you're doing all this work that not many architects are doing on like understanding like all these things going on in the city, what is the neighborhood, how you measure all this walkability and so on. And maybe the part where the architect and urban designer could come in is to then don't respond exactly what you want, but giving a little bit of something in the solution that encompasses something that is not just saying, okay, we have a sidewalk, you would just design a sidewalk and people will walk. I think the role of architects and urban planners, I imagine, will be to build something that does not respond to what is actually the need in this moment, but also looking into a little bit further. And I also think we add the issue of users that are these multiple users we are in a city. So
yeah, well, I definitely really appreciate that perspective, and you showed the high surface area sort of hair house as an approach to absorbing more particulate matter. And I think those ways of sort of pushing the conversation forward, even if it's taking something to an extreme, so that then we can come back to something that fits into a realistic solution. I wonder sort of what value folks in architecture and urban planning might see in having public health partners in evaluating the likely health consequences, or maybe just the consequences for air quality in the vicinity, trying to bring in sort of a more quantified result, where I understand sometimes the goal is not framed so quantitatively.
And I find myself, in the project we launched on trying to understand how aesthetics influences physical activity, for instance, all of a sudden we're having conversations like, all right, now we need to, as epidemiologists, how are we going to quantify aesthetics, right? How are we going to shove that into our statistical model, this notion of aesthetics? And so we find ourselves in this weird position of taking, these concepts that architects talk about, and then trying to stuff them into a SAS computer model and quantify and measure it. Places, for me, it was a very weird sort of idea to try and even think about doing that.
Yeah, sure. That would be good.
So I'm interested in the social design part of it. And I mean, thinking about walking in my neighborhood, you want to go the way where you like the people you know, it depends what kind of walk you're taking. Do you want to go where everybody's sitting on their stoop, or do you want to go where nobody's sitting on their stoop? And of course, I think different people have different objectives at different times, you know. Sometimes the walk is your social interaction for the day, and I think that's different people than the people who are walking to get to the place where their social interaction is. And I'm wondering how those ideas, which I know architects and planners think about, play into your models, and if you've thought about measurement there.
So the ideas that you're talking about are not in any of the information I shared today, although we have been thinking about it and trying to understand from the GPS data types of pedestrian activities. So, within our group, we talk about like walks where you're on a mission, right? You're on a mission to get your dry cleaning or something, versus walks that are purely for pleasure and socializing, and trying to understand from GPS data if we can differentiate walks for different purposes and then understand what influences the route you might take for a different purpose. So it's totally on our agenda and radar, and it's the thing that we would like to do next.
Okay,
So
good.
maybe if I can
Yeah.
also just respond in regards to the different goals that people have when they're walking. I think there have been a couple of intriguing directions in the research outside of our group. Marlon Bornut's done some work looking at whether having destinations nearby affects people who don't like to walk. And sees basically that some of the walkability type metrics that we're discussing have the strongest effect on those who say that they would like to walk more. And so there may be interactions between people's intentions and how much the environment matches those intentions. I think it's also worth considering that a lot of the measures we use for the built environment are optimized to predict walking for transportation. And for some people, a different set of environment measures would predict walking for recreation, walking for pleasure. And I think Esther Sarin in Hong Kong has done some interesting work on environments that may not have a net increase in total physical activity because they just shift people to doing a different type of physical activity, to calling it transportation walking or recreation walking based on whether they're walking to the store or to a park. And so I think getting some reference points, if we're talking about health benefits, that link to the total physical activity and make sure we keep that as part of the picture that we're looking at.
Okay, we'll take one more question. Teddy?
This is a question for the researchers. How do we make sure that we don't that we maintain the social context of these questions of environment and design, and acknowledging that the people who have to live in a healthy environment, we don't just find them there, that they sort of push their by larger social context. Perhaps is one of the roles of public health in these conversations to keep social determinants on the table when we talk about larger.
I mean, I'd say that the role of public health and epidemiology is very much to keep the idea of social determinants on the table. And for both my work and Gina's work presented here, the social determinants part was very much backgrounded, sort of behind the scenes of our slides. So we're very much attuned to how poverty constricts where you might live or which parts of a neighborhood you might use. And so unfortunately it was all backgrounded in our talks, but yeah, it's very much on our attention.
Okay, great. I think,
Question for Joanna. How much empirical work there is in terms of how people perceive neighborhoods as they are and the changes that you include in those neighborhoods? I mean, how much has there been in terms of looking at people's understanding, use, satisfaction? Is that part of architecture mainstream research? Is it not?
Well, I don't know. I don't think there is a real research on this. There is more like the kind of like return effect of certain like you start to have buildings that become iconic somehow, or that become an attraction. So then the neighborhood become kind of like the place where you want to go and walk. So I think that this is why I found very tricky, trying to define this aesthetic, and I don't know how you, because for example, you take. I always think like you have a city. Venice is a city where you are forced to walk somehow, because there is no possibility otherwise. Okay, you take the boat. So sometimes I always think like there has to be an equilibrium between the efficiency of the public transportation, or that maybe you walk because actually the public transportation doesn't work. Like there has to be an efficient, I don't know, an efficient between transportation, the quality of the neighborhood. There are many studies, for example, of the fact that even if you will design a street in a certain way, maybe it's not just about the design of the city. The street is about, what is the first floor, as everyone spoke about the retail spaces, is about the temperature, like if there are no plants, it's super hot. Like, it's very complex, I think, from a designer point of view, start to define which is the kind of like quality of a neighborhood that make it very interesting and walkable. So I really don't know how. I don't know, Hilary. I don't know how you. And if I think in designing a new neighborhood, for example, I'm sure you will be able, like how streets are large, or like the dimension of the street could obviously has an impact on. I even think about your project that you did last year for the MoMA show. It was also about you design something that already encompassed the idea of walking, but not as a forced action, as you will be in a neighborhood that you will want to walk. But I don't know how to explain it, or know how we could measure this. This is really a challenge, I think.
It's probably at different scales. I mean, I think urban planning, urban design deal much more with data than architects per se, in part because dealing with basic issues like gravity and things like this. I would say housing is probably the part or the architectural type that maybe goes between those at an urban scale. And so I was fascinated to hear about the guidelines for housing. This is very interesting. So, okay, on that note, I know there are many questions. Hopefully some of you can answer them a little bit, or ask them a little bit later in the day. We're going to take a 10-minute break and then come back for the second session.